So what have you come here to talk about?
People's needs for talking about how they feel are as old as human beings themselves.
I hear a lot of people say, I don't need to come to therapy because I'm not crazy.
These thoughts are just there. It's like being trapped in your own mind.
Medication can be a very important adjunct to psychotherapy.
I'm not the only person in the world with this thing. There are other people too, and there's a lot of people.
Therapy saved my life.
Therapists definitely have problems.
You don't know what kind of a week I've had, Gina.
It's difficult to deal with one's own emotions.
I don't understand you people.
Just give me an honest answer.
So you are getting a divorce?
Why not listening to me?
I don't think that's what I meant.
But that's what you're thinking.
You won't be able to handle it.
So what are we supposed to do, Doc?
I do think that you are suffering from an anxiety. And the only way I know to alleviate that anxiety is to talk.
I always think that therapy is like a miracle in our culture, that two people would get together for an hour in a quiet room with no purpose other than to say whatever comes to mind.
One person maintains a certain amount of neutrality and anonymity such that the patient can say whatever comes to mind without fear of judgment or criticism.
We're interested in the unconscious mind, thoughts or feelings or fantasies or fears that are driving their behaviors, but they're not entirely aware of.
The process of therapy unravels some of the knots in the emotional life of someone.
For some people, life is one battle after another after another. That's many of us. For people who really need psychotherapy, life is the same battle again and again and again, and that's what we want to change.
Maybe you can tell me a little bit about yourself.
Paul practices a psychodynamic therapy in which he's interested in finding out how somebody's feelings about themselves and other people is dramatically influencing their life and unhappiness.
Really all started 20 years ago.
You mean when I was your therapist?
All these years later, now that you know how it turned out, what do you think about that pregnancy?
Me as an example of someone who could really benefit from a psychodynamic treatment because she is running in her life a script that isn't playing well.
I want a partner. I want a family and a home before it's too late, which it may already be.
I understand.
Can you help me with that?
As a psychotherapist, I'm thinking she wants certain practical things from me, like a partner, a baby. But she knows that I'm a psychotherapist. I don't give people partners or babies. I help people get insight, clear away obstacles to getting partners and babies.
Your wife was pregnant at the same time I was, but you thought that I should get an abortion.
You think I wanted you to get an abortion?
You don't want to say, that's not true, I didn't do that. You want to say, well, tell me what I did. I want to hear what I did to force you into that abortion.
I was getting ready to go to law school and I got pregnant and you didn't think I should have it.
Me is a perfect example of someone who externalizes responsibility and therefore blame. The therapist is a target of it, not because he's specifically the therapist only, but because she does that to everybody.
I can't do it. I can't play this game.
I would really love to treat somebody like Mia because I think it would be fabulous for her to be with me, a woman. She would probably find a lot of fault with me, so it might be a corrective emotional experience for her.
Do you have anything to say to me that's real?
Sometimes people need to convince themselves that you are strong enough to be able to tolerate their feelings. And so the only way that they can find out is to challenge you.
Where did you go to school?
Are you worried I'm not qualified to treat you?
Is there someplace I could hang this?
I can put it in the waiting room.
Oh, no, in here. Yeah.
There was something very interesting about the way that Walter entered the space. You got a very good sense of his personality and how he tries to manage the situation.
They portrayed him coming in with his BlackBerry, and the therapist didn't ask him to turn the BlackBerry off, even when it kept going off. I thought that was consistent with the way that I would have handled the situation.
So what did you want to discuss?
I haven't been sleeping well lately.
He's complaining about insomnia. Does he have physical complaints?
We don't know anything about, whether depression is an issue for him. We certainly see that he has a lot of stress.
What's his mood like? What's his emotional expression in this session?
Walter has two problems: the immediate situation that he's in, which is what he wants help for, and the much longer term, which is how he conducts his life.
We're going to have to dig a little deeper. We're going to have to do a little bit more work.
You don't have to mollycoddle me. You have a lot of experience. Use it. Tell me what my problem is and what I need to do.
A lot of patients come in with this idea that seeing a therapist is similar to seeing a primary care physician, where you go in, 20 minutes later, they tell you what the problem is and they prescribe something.
The kind of therapy that I practice, it's not a quick fix. Eventually change happens, but it does take time.
A good part of the process of psychotherapy is helping somebody have the patience to sit with you and take the time and to give them enough understanding so they can understand why that's an appropriate thing to do.
He's not sure that he respects the therapist yet, and he tests, very explicitly tests the therapist as to whether he's going to be a credible helper.
I think I've talked enough. Would you mind telling me what you're thinking?
That does paint sort of a realistic picture of what some patients can be like.
How many people come to you with, a really big problem?
Like what?
I can't get the words out of my mouth. Can I write it down?
Of course.
While we always need to feel and experience something in relationship to our patients, one of the biggest challenges for a therapist is to be able to use that information for the benefit of the patient rather than being overwhelmed by it yourself.
What type of cancer is it?
When someone has a diagnosis of cancer, it's such an overwhelming experience, especially for a young person, because it totally takes away what their whole life trajectory looks like.
I've had situations where people have come in with life-threatening illnesses, and what I've noticed is that what the patients don't want from me is any kind of sentimentality.
Maybe I don't want to get treatment. Like if I tell you, maybe I want to die right now, right here on your couch, you're not gonna jump out the window, right?
What we hear is the pain, the frustration, the sense of helplessness in the words.
It's okay to ask for help.
This is someone who's scared and is using her denial as a way to protect herself because she doesn't really know how to deal with it.
Everybody at some point in their lives needs help. And I think that you need help now.
You haven't heard a word I've said.
You have to offer her a different kind of experience. And even if that means, as a therapist, you're sitting on your hands and you're, watching a patient do something that you consider to be really self-destructive.
The challenge for the therapist is to try to help the patient without being overwhelmed by the feelings that they are inevitably going to have when they hear about such awful information.
It is my duty, my professional duty, to protect you, April, from self-harm.
A psychotherapist is often very moved or concerned or wants to reassure the patient, but we have to abstain because it's not in the best interests of the patient for us to intervene.
I have this patient, Oliver. He's a kid who's trying to survive his parents' divorce. And it's taken everything I have not to invite him to come live with me.
I have a question. Why am I here?
Nobody has explained it to you?
Treating children is a different approach to treating adults because children don't come in thinking they have a problem necessarily. Most of the time, their parents come in thinking their children have a problem.
You know that your mom and dad are in the process of getting a divorce.
I knew that Oliver had no idea that his parents were getting a divorce, or if he did, he was blocking it out. And I thought that they were late because they wanted Paul to tell him, and they couldn't handle it themselves.
He doesn't actually know that you two are getting a divorce.
Did you explain that to him?
No, I didn't, because I don't believe that it's my job to tell him things that you both find painful to say to him.
I saw Oliver as a victim of his parents' chaos.
A boy who's just struggling with all these feelings as his parents are acting like children.
This is what he does. He arrives late with apologies and gifts as if that's going to make up for it.
Look, believe me, I wanted to be here today. On time, because I wanted to get here before she had a chance to say too many things like that.
The anger that they were spewing at each other went straight into Oliver.
Oliver's issues are really a symptom of the issues within the family.
Can you make my mom and dad happy?
Kids think differently than adults. Their cognitive ability to understand concept, for instance, differs depending on their age.
Kids don't necessarily talk about their problems, but we build a relationship through having fun. And then when they have a problem, they know they can talk to me.
What kind of game would you like to play? Hearts, War, Crazy Eights?
Legit.
One of the most important things for working with adolescents and young people is providing a space for them to be themselves, a space for them to speak how they want to speak and to talk about different experiences that they might not feel comfortable sharing with other people.
I'm not going to force you to talk to me. But if there's anything that you do want to talk about, this would be a good place to do it.
Offering a place where you really see that young person's strengths and share that with them can be really important.
I think going to see a therapist is kind of like dating, because you have to have a certain chemistry with the person you're speaking to, and you're revealing all of your thoughts and feelings and emotions, the deepest, darkest things you've ever felt.
It takes a tremendous amount of courage for someone to come to someone's office and share the most intimate aspects of their lives.
I had developed an eating disorder in middle school that was left untreated, and I thought that it was just my way of dieting. I thought that I didn't belong in therapy because I wasn't 90 pounds or 300 pounds. It just got worse and worse and worse, and I didn't even realize it until my dad and my mom separated and divorced, and I just, from that moment on, just hit rock bottom.
When I went to therapy at the beginning, it was hard to build the trust.
For me, it's because I don't really share what's going on inside, not even to my family. So for me to actually talk to somebody, a stranger, I have to feel that I just trust the person initially.
You have to go through all of this stuff that you've done before and tell them, intimate things that you don't want anybody to know, and they have to give you something back.
Therapy is something that, I had thought about, but never really did. And then I was diagnosed with prostate cancer. I was planning on getting married. And I have this thing about commitments, but, I stuffed that away, too. Then I started breaking out in hives, and my fiance at the time said to me, maybe you ought to go see another doctor, someone that deals in psychology. And I said, well, what are they going to do for me?
I'm here to listen and learn from you, and then using my professional skills, I can try to help you with that experience that you come from.
All of a sudden, you realize that talking about a problem is sometimes the best way to really look at it from another angle.
With some patients, the trust is quick, and with some patients, it's the whole process.
After I built that trust, it was, really everything really changed, and therapy started working back then. I always knew that I was gay. The fact that I was never able to accept it, and because of my family and because of my friend and the society that I was living in, I was feeling a lot of pressure from my father and my mother. Therapy helped me in Italy, when I was in Italy, to actually accept myself. And my father asked me, I think you're bisexual. And I said, no, I'm gay and I have a boyfriend.
In the back of my mind, I feel like if I'm really honest, is she gonna think I'm nuts? Some of these things I had never said to anyone, ever.
I didn't straight up lie, but I kind of withheld information.
I'd forget a few details for her because I wanted to be the perfect patient.
I thought at first when he started asking me about my sexual relations, it's none of your business. He'd say, well, then why are you here?
Knowing that I can say these things, not be judged, get it off my chest, and then also have the chance to process them in a way that I've never processed them before is really helpful.
Later on, I became more and more truthful. I think she probably knows things about me that none of my friends or none of my family know.
My divorce brought me to therapy. Just being in the same relationship for 13 years, we really, really grew apart. And then having the responsibility of raising children with these two totally separate sets of ideals was I want to say it was like a volcanic eruption. My children are my world, and I would find myself not even able to relate to them. There's always the mantra of the strong black woman, and I am a strong black woman. I'm very strong. But you know what? This strong black woman just also needed to have to go to therapy.
It is very difficult for some patients who come in because there's so much stigma within so many communities.
In the African American community, Going to therapy is really looked down upon.
On the Upper West Side, going to therapy is just normal. In other realms of my life, saying that I go to therapy is embarrassing.
I think therapy isn't necessarily dismissed, it's just not talked about as a viable option.
The idea that coming to therapy acknowledges, or not even acknowledges, but would signal to the world that I have a big problem and I can't deal with it myself.
If you have something going on in your life, you should deal with it within your family.
Going to therapy doesn't mean you're crazy, it doesn't mean you're nuts, it doesn't mean that there's something wrong with you.
My dad died when I was 10. I don't live with my mother. She wasn't able to take care of me. My family history of depression has been something that I've been trying to deal with. I was in the process of applying to schools, and there was all this pressure on me to perform, you know, and to be the best. Part of that was my pressure on myself.
I went to therapy when I was about 13 years old because I was diagnosed with a severe obsessive-compulsive disorder. Everything that I say or everything that I read flashes across my mind, almost like a picture. I break phrases and words down into groupings of 3. I would map out everywhere I would go. I would get out of my bed in my bedroom, and I know, even now, that it's gonna take me 6 steps to get to the door, which is nice because 6 is divisible by 3. Sidewalk blocks, I would step in the middle, step on the line, step in the middle, step on the line. It's like being trapped in your own mind. It's the one place that there's 0 chance of escape.
Obsessive-compulsive disorder, it's a terrible illness. Why? Because it captures not just emotions in its anxiety, but in conscious thinking as well. And someone is compulsively driven to repeat either certain behaviors or certain thoughts.
I don't know if I would have been able to get where I am right now had I not taken medication.
There are people who come to talking psychotherapy who don't get better from talking about things, and sometimes those people need medicine.
I've been on Prozac for many years. There was like thoughts like rolling on in my mind and I couldn't get rid of them. So therapy helped me a lot in that, and also the Prozac helped me a lot in that as well.
One thing that I told her was that I just wanted to find a way to get better, but without the need of any kind of medication.
Medication like an antidepressant can be something that a client might need to help them get through some very difficult things.
The medicine can lower the volume on the stress, the anxiety, the depression, so you can begin talking about it and working on what the underlying issues are.
I think that it should be used very cautiously, and I think it should only be used in conjunction with therapy.
In summer of 2003, my little brother, he passed away, and people would come by to visit our family to console us, trying to say I should join a church. So after the guilt and the grief, I had this anger that I couldn't explain. It could be like a pebble inside of me, but it'll keep on building and building and building until it becomes a boulder. Then I just hurl it at whoever's closest to me.
Often people come because they're in some immediate crisis.
What brought me to therapy initially was the tragic loss of my younger brother, who unfortunately took his own life. I entered this suicide survivor therapy session. You know, I was just coming to a point in my life where, you know what, I was stronger, I was feeling good, and September 11th happened, and I lost my older brother in the World Trade Center on that day.
When something suddenly happens, you might have to define a new normal. After September 11th, there was a new normal. And so for every trauma, we have to tell a different narrative.
My therapist can push me towards the progress I need, you know? But I have to be willing to walk through that door and do whatever needs to be done.
There were times I didn't really want to address that anger, but she wanted me to address it head on.
I hate to be challenged. I need to be challenged.
She'll fight me and I'll fight her.
I negate everything he said.
I would lash out.
You didn't have to bring it up like that.
I'm not that kind of person.
You see, you don't listen to anything I say, and you don't want to be helped.
When I took steps kind of against her and said, like, I didn't want to do it, It was a step forward for me.
When therapy is working, the emotional story that you're listening to gets deeper, more complicated, and progresses. And the patient feels that they're getting somewhere.
Therapy gives you a lot of coping mechanisms to get through the day-to-day.
The luggage just disappears little by little, and all of a sudden you feel like you're stripped down to nothing. When you're really not, you've got rid of a lot of dead weight.
Finding the right therapist is the most important part.
You have to find a path together.
The fact that you can get to some kind of truth about what your experience is in this life, in this world, through that process is a wonderful thing.
What is it about this room that makes things seem different?
You.
As you get deeper into someone's emotional life, as they get deeper into their own emotional life, the therapist has to be very careful to see whether or not they can handle it and use it.
I was asking for your advice. Isn't that your job?
It's possible to live in a world where people let each other down, where they disappoint each other, but still help each other.
It's unreasonable to expect that we're not touched by our clients' experiences of sadness. If they're suffering, I'm suffering with them.
Therapists are human, so certain things are going to be more upsetting for me than for another therapist, depending on what my own life experience is and where I'm at this particular point in my life.
I'm just afraid that she's going to die, and I'm angry that she won't let me help her.
You can only be responsible for what happens in treatment, Paul. You know that.
How do you take those feelings that you're having, but not express them, not act on them? And it's simply a matter of time and training and experience.
What makes us equipped to deal with and do the work is not only are we trained and we study, but we also go through our own analysis.
I did go through a very classical analysis that was done 4 times a week on the couch and took many years.
You get to understand what your weaknesses are, what your blind spots are, how you might get overly involved with particular types of patients.
If you've studied your own psyche, you're really in a good position to work with other people.
Therapy really gives me tools to be who I am uninhibited every day of my life.
I discovered that I am way, way stronger than I ever thought I was.
Why things make me feel the way that I feel, why I think the way that I think.
Patterns that exist, the destructive ones that I clung onto for dear life because that's all I knew.
I love everybody, and sometimes I don't love me enough.
A therapist helps everyone understand that some days you're going to be gray and some days you're going to be pink. And I dress accordingly, ironically.
The cure is really knowing that you have a nice, full toolbox that's going to help you navigate your life in a way that's most satisfying.
I don't know what to do. What do I do?
When you're feeling like that, you call me. Do you understand? That's what I'm here for.
What if there was no course of action for people who are not physically bleeding but are hurting just as much on the inside?
The real happiness that comes out of life is when you're able to give yourself over to the needs of others.
What we're asking of them and what they're asking of themselves is something very profound.
You ask questions that you never asked before, and you get answers that you never heard before.
You could also look at this as an enormous opportunity to take a leap into the unknown.
It's a privilege that people come to me and entrust their most important ideas and feelings.
It's been a lifesaver, an absolute lifesaver.
Therapy's not easy. Delving into yourself it's the hardest, scariest, but most worthwhile journey I think anybody can take.
It's fascinating, but it's also emotionally rewarding. And helping people, seeing them get better, it can't be beat.
I know you must feel overwhelmed, but it's urgent that we talk about this feeling in here.